We've had different approaches, right? Here in the UK, even last week, the Prime Minister was saying, actually, we want to immunize people, so it's better if a number of the population get it. Others have thought, that this was not the right case. So would you call for an immediate lockdown? Is there any truth in actually locking down at an optimum point? Because if you do it too soon, people then don't follow the rules.
So thank you. I mean, this is such a new virus, and we haven't seen one like it before. We've only known about it for 3 months. And so different governments are naturally trying to feel their way into it. Some have moved very, very quickly. Others have moved more slowly. I think the consensus now is that you really do have to move quickly in order to reduce the problem. I don't like using the term lockdown. That's not really a control strategy. The way we control it is, firstly, by people themselves understanding that physical distancing really matters and putting that into their lives. Secondly, having good quality public health services to find people who are diseased and then to isolate them and to ensure they get proper care in hospitals that are repurposed to that end, and then getting the whole of society organized on continuity. If you do those things and you do them quickly, you get this under control quickly, and there's less necessity for drastic curtailment of people's movements and behavior, as we're seeing with what you've described as lockdowns. And when you've got a lockdown, provided you keep the public health work going, you will be able to get it under control, and then you can release the situation, as we've seen China has been able to do after some weeks. My point to everybody is this is a containable outbreak, a containable pandemic by us, and it's up to us to get it right. And there will be some pain and there will be some uncertainty as governments try to work out the best blend of action. But once you've put the strongest and most robust actions in place, then you can get on top of it. We've seen that in South Korea. We've seen it in parts of China, and we've seen it in Singapore, and we will see it in Europe. But it's going to take a bit of time because we've moved into this really strong phase a little bit slower, perhaps, than would have been optimal.